Thank you. So if you look at the global burden of cancer, that's a worrying indication in those numbers. The numbers are big, but unfortunately, you see that where we are, we seem to have the largest burden in the Western Pacific region, which Malaysia sits. And there's multiple factors that contribute to that. There are many countries, including Malaysia, which is rapidly aging in our part of the world. Many countries that are rapidly advancing economically, contributing to better diagnostics. But at the same time, the urbanization, the impact of risk factors is increasing. And I'll talk to that later within the context of the Sustainable Development Goals. But the end result is that among the 6 WHO regions, we currently have the highest burden of cancers. And if you look closer home at Malaysia, we report about 0.76% of the Western Pacific's cancer cases and about 0.25% of the global cancer burden, which is in numbers over 50,000 cases. What is worrying is that in Malaysia, we are seeing an increasing number of cancer deaths among children and adolescents. So it's not only people who are living longer who are at risk of cancer, but it's also our children. And that robs a country of its future potential. And we have to be aware of that. We have to do something urgently about it. If we look at the details of the numbers, and I'm not going into this because I don't know this actually. This Suntari will talk better about it. National Cancer Society probably generates more of these numbers than are reported to WHO. But what is important is that there is a worrying trend, and it's increasing, and there is a need for us to do something better. And if you look at the trends and the predictions, the numbers are even more worrying. We are seeing the 51,000 cases that we are currently reporting, it's expected to more than double by 2050, right? Now that's in real numbers terms, but you also need to look at it in the context of population growth. Because your population growth is slowing down. Your basic reproduction rate now is 1.7. So you're not replacing. Your population is growing due to longevity, increasing longevity. Which means that the increasing cancer burden is going to have a more significant economic impact on your country. I'm making the case to say not only cancer but health is an investment. It's not an expense that a country, that a society bears. It is an investment for the development and furtherance of a country's economic potential, its capacity. Now, As Felicia mentioned, I'm not a cancer specialist. I am a public health specialist, and there is a continuum, and there are a list of eloquent speakers who will be talking on each of these topics if you look at the agenda. So I'm not going to talk about this. I'm going to look at it from the perspective of the Sustainable Development Goals, because that's what I have been asked to do. So I'll skip through these slides and try to spend more time on the actual Sustainable Development Goals. And some of you may find it boring, because obviously a lot of you are from the medical fraternity. But I'm going to step out of my normal shoes and give a wider Sustainable Development Goal perspective. Because as Professor Dang already mentioned, cancer is a priority. It's within Sustainable Development Goal 3, which we talk of health. But cancer and cancer control is just not limited to Goal 3. And that's the message I'm bringing, right? Not uniquely, we've tried to deal with many health problems within the health sphere alone. And the end result is that you see that we are not doing a great job, and that's reflected in the increasing trends. In improving the rehabilitation and palliative care, the reintegration of patients. But we also need to look upstream. What's driving it, right? Because we are otherwise faced with a losing battle. We have to do something to reduce the trend of new cases. And that's where the Sustainable Development Goals comes in. So, with my apologies for not being limited to SDG 3 and UHC, I'm going to talk about other SDGs and their vital importance. So we have what we call 5 domains within the UN, and the Sustainable Development Goals are placed within these domains based on how they act. But clearly the purpose of the Sustainable Development Goals is to come together as a society, not to work in silos, right? And I've heard it before, I've heard it this morning, and I'm telling it now. WHO is not trying to be in silos. We want to work across societies. But it's also the responsibility of national governments, of ministries of health, to work across, to have the whole of society approach, right? That's when we can succeed. So, as we take stock, we need to look at how can we engage beyond, how we can create the knowledge and what needs to be done beyond the health sector to, in this case, address the increasing burden of cancer, the increasing prevalence of risk factors contributing to cancer, which we know fully well. And if we ignore that and focus on just the detection, management of cancer, we're going to lose. The predictions are clear. So, from a contextualization perspective, it's important to have that view, right? So, SDG 3, it is the fundamental core component from a health perspective and from a cancer control perspective. And the key aim of WHO, aligned to the SDGs, aligned to our GPW 14, which was just endorsed by the World Health Assembly, is universal health coverage. And it's not just talk. We break it down. In this instance, we look at cancer control. What is the access to cancer diagnosis, to cancer treatment and management? Is it universal? Many of our countries have 1 or 2 cancer centers. Many of our countries, we can count the number of oncologists on the fingers of one hand. That's not universal access, right? So there is a critical need to acknowledge the risk we are facing and to invest in expanding capacities. If we do that, we can reach more people. And if we reach more people, from a preventative promotive perspective, we will be able to create the awareness, minimize the exposure to risk factors. From a diagnostics perspective, we'll be able to detect more, detect early. And from a management perspective, we'll be able to better manage patients. If we don't do that, we will be leaving people behind, right? And the whole SDG is about leaving no one behind. And in this particular instance, we are talking of cancer patients. I'll give one example how we are doing. Colorectal cancer is one of the top 5 cancers in Malaysia, right? Both for males and for females. Do you know that 70% of colorectal cancers in Malaysia are detected in 3rd stage or 4th stage? That's a reflection of how good our UHC is, right? How good our awareness programs are, how good our screening programs are. Because obviously, the outcomes are going to be poor. It's late stage diagnosis. So, we need to look at what are the contributing causes. The health white paper already recognizes that we are not putting enough money into health, right? There is a need to increase the money going into health, currently at about 4% GDP, to about 8% at least. There's a commitment from the government side to increase it to 5%. If that happens, we could make some inroads, make some progress. The transition team is working on novel financing modalities. We are also looking at human resource capacities within the system, because it's bringing all together. That's what the transformation means. It's about creating literacy, right? And you know what? It's not about the lack of knowledge, right? People know. But does that knowledge actually promote people to make changes? People know that smoking is bad, right? Yet people smoke, about 40%. Industry, we are fighting a battle with industry who makes out that vaping and e-cigarettes is a cessation tool. When actually analysis done by countries show that the nicotine content in some of those pods is 5 times higher than what you would find in cigarettes. So somebody smoking a pod a day is probably smoking the equivalent of 5 packs of cigarettes a day, unknowingly. That's the risk we are dealing with. So we need behavioral insights on what will promote people to change their behaviors, not just knowledge. Because the access to knowledge is there. We need, importantly, female empowerment, right? The ladies decide what foods go on the table, how it's prepared, how much of salt and sugar goes into it, how much of starch is consumed. So if we don't empower the females, it's lost before we started. Food and water security. Nothing new. The last few days we've been seeing multiple situations of food poisoning in Malaysia, including, unfortunately, a couple of deaths reported last week. But it goes to raise the question, how safe is our food? Right? Because the poisonings that get reported are the obvious immediate consequences. What is on the long term? How safe is it? How safe is our water? Our natural water sources, are we protecting them from chemicals that are potentially cancer-causing? We find microplastics in the placentas now, right? Are we protecting our biodiversity? Are we getting rid of our pollutants? What is the quality of air we are breathing? Right? WHO estimates that 7 million deaths are happening globally due to poor quality of air. So it's not just health, right? If we stay within SDG 3, we've lost. Energy, equally important. What is our source of energy, right? How do we cook? Is it polluted air? Are we using gas in closed circumstances, closed atmospheres? Financial equity, access to detection and treatment, right? Again, I go to the question. It's not just a lack of knowledge. Sometimes people have signs and symptoms, but they'll opt to ignore it or not go for a checkup because they want to prioritize educating their children or something else. So how do we make financial equity more stable for everybody? Access to services more universal. And we have a huge battle on our hands with addressing the stigma, right? Still, it's like a death sentence. Many people don't want to hear that they are diagnosed with cancer. What can we do to overcome that? To give them the confidence that you can be treated, you can come back to your functions. You or your family are not going to be adversely affected by out-of-pocket expenditure, where your whole income will go to managing the cancer and its implications. So it's important for us to come together. The Ministry of Health, the Ministry of Environment, the Ministry of Youth and Sport, the Ministry of Education, everybody needs to come together. And that's what the Sustainable Development Goals are about. Because if we do it that way, ultimately, the number of positive diagnoses from our clinical work, the management outcomes, because we are diagnosing them early, and the rehab processes will become easier. So, if we are contextualizing cancer within the SDGs, we need health in all policies. And if we can do that, I think we will make better impact and better progress, and hopefully bend those curves that are skyrocketing up right now. Thank you for listening.
Thank you very much, Dr. Rabi. I would ask that you stay on the stage, please, because we have the Q&A session coming up. So, Dr. Rabi, you gave us a very nice summary about how it's important to target the upstream when addressing the burden of cancer, including non-health factors as well as health-related risk factors. So, with your perspective as the head of the WHO office, could we ask for your insights onto the major risk factors in the region where if we reduce them, it can bring the most impact? So you mentioned microplastics, smoking, salt and sugar intake. Do you have one wish list, the top one that you would wish to be tackled?
Depends on which age group,
right?
Because the risk factors are multiple.
Right. Can we go with Malaysia then, being a bit selfish as a hosting country, and maybe all the age groups, please?
Yeah, so we love our makan, right? But we need to be careful, what are we consuming, right? Is it healthy? Is it fresh? Is it processed? Is it ultra processed?
Right.
What are we adding into it? What are the food additives?
Right.
These are the cancer causing agents, right? So what is the awareness we have? What are importantly, what is the legislation we have in place to manage industrial productions, right? So these are things that we need to do better if we really want to control. But if you're talking childhood cancers, there is different factors, right?
Okay, thank you very much, Dr. Rabi. Are there any questions from the floor?
Thank you, sir, for a graceful lecture. I'm an endocrinologist, so I would like to ask you about WHO. Are they aware about the endocrine disruptors causing cancer?
Yes, we are aware. I mean, it's not my forte. We have IARC, which I believe is joining this meeting, and they are a leading cancer research wing that handles all of that information. They are aware of the endocrine disruptors and their potential impacts in causing cancers. Yes,
Yeah, I will not make a comment related to the silo because still I am convinced with that. But WHO, since long time, they are talking about UHC, universal health coverage. And I would like to understand the progress happen with UHC, especially in the country where I'm now. I am aware more about Africa that most of the UHC strategies collapsed, like NHIF in Kenya or you see in Uganda. So from the region here, if there is any success story as UHC?
Yeah, I mean, Malaysia is a success story. The UHC index is about 0.79 right now. It's not still ideal. It could be closer to 1. It shows that there are still areas where we have challenges in access, inequity, and that is why the health transformation is focusing on strengthening primary care, because our belief is that having multidisciplinary teams at primary care level will help advance UHC, will help access to a wider range of services, will reduce the congestion at secondary and tertiary care facilities, and help make better use of it. So that's the justification and the argument.
Hi, coming from Singapore, what are the lessons that you can see is being practiced in Singapore that can be applied for Malaysia? I'd like you to share some views on that, please.
I can't pick up on a single one, but we are talking conceptually, right? And there are many good things coming out of Singapore, particularly also linked to their new initiatives on healthier SG and age well SG, which could have impacts. We've seen also that under the healthier SG, Singapore is trying to link the private sector GPs into a network of primary care providers, which Malaysia is also in the process of implementing. It's also important to look at, and we have been promoting digitalization as a key strategy, because providing digital access to treating physicians to health records helps them to contextualize whatever findings and come to better conclusions rather than looking at a set of records. So there are multiple things that are good and are happening in Singapore that could, oftentimes we hear the thing that Singapore is high income, it's a city-state, what it does not apply to other countries. But that's why I said you need to focus on what is actually happening and what can be scaled up, right? And there are many things that can be scaled up. And for me, it's like a pilot. What you're doing is like a pilot. You've given the proof of concept that it works, it has impact. So it's then how do we adapt that to our context and how do we make it happen in our situation? So you don't need to do everything that happens within a pilot, but you need to contextualize how do you get an equal or lesser impact or even a higher impact by contextualizing it to your conditions, right? And that's the way you need to look at it.
Okay, thank you. We have time for one last question.
Okay, nice. Quick one. Yeah, thank you so much, Dr. Rabi, for the great presentation. My question is more on the social determinant of health and social financing, as you've mentioned just now, the sustainable development goals. Although, yes, we recognize that the micro and macro factors that you mentioned could help to bend the curve. But I think for the LMIC, the socioeconomic status and disparities in access to the cancer care determine a lot on the cancer outcomes. My question, therefore, is, has there been any initiatives and thoughts and discussion from the WHO angle that integrates the LMIC and looking at social financing, either through the social business models for different countries to work together to try to improve the socio-economic situation of different people in different countries?
It's something we are looking at, including here in Singapore, in Malaysia, because social protection becomes vital as a society ages, and having adequate access. Clearly, I mean, we know that the risk of cancer increases with the risk of age, right? But that's also when the earning potential decreases and you need social protection to kick in, right? Because otherwise, you're dependent on your dependents to provide that service. And you know, Malaysia is aging. You're expected to be an aged society by 2030 and possibly a super aged society by 2040. And the economic modeling shows that the number of dependents per working age Malaysian will double by then. So that is why we're talking of social protection for the elderly. From an economic perspective, it's critically important. If we fail to do that, there's going to be hesitancy in seeking treatment. We're going to see more and more late-stage cancers, right? So that's the importance of it. And it's the same for many LMICs. And that's why we are talking of UHC and PHC as a mechanism. And believe me, we know that governments cannot fund the entire health expenditure, right? We need to look at innovative mechanisms of financing health. We need to look at health as an investment rather than an expense. So if we can make that shift, then whether you're an LMIC or an upper middle income country or a higher income country, I'm sure we'll have better outcomes.
Thank you very much, Dr. Rabi. Before you leave the stage, I would like to call upon Dr. Santari Samasundaram, President of the National Cancer Society of Malaysia, to present Dr. Rabi with a token of appreciation.